there's no gold standard physical test. So if you put them in your treatment room, your biggest sort of indicator that you've got somebody with a lumbar bone stress injury is the subjective history, this classic history. When we start to do objective tests, we start to run into problems. There's nothing that's going to be robust enough. We've talked about going into extension, going into side flexion, stalk tests, a whole bundle of things. And each of those contributes to my sort of risk factors, but there isn't a robust test. Most commonly, they are worse on extension and or side flexion, and certainly when you combine it and compress the painful side, you're much more likely to reproduce their pain. And it's very rare, I would say, that if extension and side flexion combined cause pain that reproduces their pain over the area where they're indicating it is, that a bone stress injury is not present. We don't see many facet joints. We see no muscular issues in this population group. So whilst you can get juvenile discs, you can get a few other things that aren't happy in those regions, your most likely movement provocation is extension side flexion. And when you've got that, in experienced hands, you may decide that you're going to proceed down a rehabilitation protocol, and there's very little role at this point for manual therapy because the spasm will be there to protect the bone. So even if we do some soft tissue work on them, it's going to come back because it's still trying to give some bracing type effects to the bony area. So I don't tend to find that unless the patient's in a lot of pain that I actually do any of my manual techniques at this point. Much more likely I'm going to start to get them on a program of breathing and exercises. But more and more, my tendency is if I were able to get an MRI scan on every child, I would. And that's because what the MRI does is it shows us the extent of the injury. So if we take our bone stress injuries as being on a level of 1 to 4, the ones are basically just maybe asymptomatic even, and maybe just intermittent symptoms. Our 2s have got bone marrow edema there, but no fracture. 3s have got an incomplete fracture, and 4s, they've gone to being that complete. So what that suddenly does is dictates the timeline that I need to keep this child out of extension-based activity. And it shows me whether perhaps the child may need bracing or they may need other interventions. They may actually need further imaging to really identify if the injury is just located in the pars or if it's spread either to the transverse process or the pedicle. So MRI is really a very, very useful tool for confirming your diagnosis, making sure that we've not missed anything, but primarily understanding the level of disease. And you asked about x-rays, and really when I qualified, and I'm very old, we used to be told that we were looking for that Scotty dog sign that an x-ray would show us. But if you think about it in terms of by that point to get a Scotty dog, you've got a complete fracture. So really what we're going to do is end up missing a whole pile of kids that do need to be have activity modification. They do need to change up what they're doing. But they're not going to show up. That mild bone edema will not show up on an x-ray. It has to be a specific set of sequences on a high level MRI scanner. But we then went towards, does everybody need a CT scan? And absolutely they don't.